Hi, my name is Raymond. For this project, I would like to do a research on global health. As you already knew that global public health has always been a concern to each individuals, global organizations, and nations. The health of the public directly influences each person socially, economically, physically, and psychologically. So it's very important to understand and to see the trend of public health over the past years. So for the purpose of this research, I would like to focus on three areas. First is the reproductive health, followed by life expectancy and disease prevention. As you can see that the source of my data comes from the World Bank, which is an international financial institution partnering with government and private sectors with the mission to end extreme poverty and to promote shared prosperity around the globe by providing grants and loans. The data has a temporal coverage from 1960 to 2019, but most of the data that I use are from 2016 and 2017, as this year's have more comprehensive data available for me to analyze. So just take a look at the data. So in my data set, it has columns like the country name, country code, indicator name, indicator code, and years ranging from 1960 to 2019. And it also includes a tab called topic, which include a list of topics that I can choose from to analyze. And it also comes with a country tab where it provides the basic information for various regions, various areas, and countries. So the first topic that I analyze is the reproductive health. And from this graph, you can see that the map is based on the mortality rate of infant per 1,000 live births. And you can see that the higher mortality rate a place has, the darker color it gets. So apparently you can see that the areas like the sub-Saharan Africa and South Asia have really high mortality rate. And just to name a few, out of 1,000 live births, you can see around like 72. You can see like around 72 deaths in Democratic Republic of Congo's, and you can see like there is a 79 death in the Nigeria. So this is really hard trending, as where you're born can partly determine your risk of dying. And I think this can be somewhat explained by the indicator that I choose from this data set. And this is an interactive donut chart that I make out of the pivot table that I created, along with the country name slicers where I can control the data that I want to see. So how I make this is I create a pivot table. So I select the country name as one of the few, and then also 2016 data in particular with the indicator name, with the birth attended by skilled health staff, maternal death, newborn protected against tetanus, pregnant women receiving prenatal cares. And the way how I make the donut chart is by inserting a blank donut chart, and then I just right click, I select the data that I want to add in the series value, and I chose the value that I want, and that's how I make the donut chart. And then I just make the customization on a donut chart, and that's how I end up with the interactive chart that I want. So just to give you an example to see why South Africa has such a high mortality rate, you can click on the sub-Saharan Africa and you can see that approximately almost 40% of the new birth is not handled by the skilled health staff, and there are almost 3% of maternal death in the Africa area, and there are around like 25% of the newborn does not get the tetanus protections, and a lot of pregnant women don't get the prenatal cares. And sad story aside, from this line graph, it's glad to see that mortality rate has dropped significantly from 1990s to 2019, especially for the sub-Saharan Africa and South Asia, as they have a 50% of decline. And hopefully these trends will continue to go in the right directions. So the next topic that I analyze is the life expectancy from 1960 2018. And you can clearly tell that from this line graph that life expectancy from different parts of the world are steadily increasing. So to see what the percentage of increase or decrease is from year to year, we can use the slicer on the right here to select 2 different years. So just to give you an example, let's say I want to know what is the percentage of increase of life expectancy from 1960 to 2018. I could just select 1960 and 2018, and it will show me the percentage of increase from different region. And in average, you can see that the world has a 38% of increase of life expectancy, and areas like Africa, South Asia, Middle East, and East Asia have over 50% increase of life expectancy. And this is a good sign that the medical conditions of each region has improved from the past to now. And last, I will focus my attention on the disease preventions. And from this horizontal chart, you can see a child immunization percentage for various vaccines, such as PO3, measles, HIP3, Hep 3, DPT, and BCG. And this is also an interactive bar graph where you can compare different countries. So let's say I want to see, take a look of the sub-Saharan Africa, and we want to compare that with, let's say you want to compare that with Spain. And you can see that there are a lot more child in percentage who got immunization in Spain than in sub-Saharan Africa. And this can probably tell why that the mortality rate in sub-Saharan Africa is higher than a lot of richer countries around the globe. And you can play around this slicer to compare different countries by just selecting different countries in the slicer. And other than vaccination, I also look at factors like percentage of population using at least basic drinking water services and sanitation services, the prevalence of HIV, number of physicians per 1,000 people, and number of people who are undernourished. To retrieve this information, we can also use the same slicer on the left here and just click on the region that you want to see, and the information will tell you that let's say for Mexico, that there are 99% of people are using at least basic drinking water services, and there are around 91% of people are using at least basic sanitation services. And it also have another chart where it shows the prevalence of HIV and the number of physicians available per 1,000 people, and the number of people who are undernourished. And when you click on region like the South Asia, you can see that there are a lot of people who are undernourished and a lot of people who don't have the basic sanitation services. So the purpose of this research is to create awareness of global health. Although overall people have higher life expectancy and lower mortality rate, It's critical to understand that there are still a lot of people around the globe living in poor conditions where there are no basic water drinking services, no basic sanitation services, and insufficient amount of physicians. And I believe that this situation will get improved as more and more countries provide help to those nations in need. And thank you.